So when I'm in my patient's room and they're going down, I take a step back, think, and I look around. I check out the heart rate, the blood pressure, the SpO2, because the therapists know that how we do. Check the adequacy of ventilation. I take a needle and syringe and do a blood gas analyzation. I'm gonna check the PaCO2 before I get some lube and insert a tube. I'll be real mean and aggressive with the wean, so I can get you off that breathing machine. So when you walk into a patient's room, quite a bit that you've got to take in and a lot that you can deduce from that. So aside from this patient being attached to the ventilator via an endotracheal tube, and that ventilator obviously saying stand by, that would be the first thing that would be alarming or shouldn't happen. But for all intents and purposes, let's assume that the ventilator is functional. Well, let's tend to look at everything else based upon observation solely alone when we walk into the room that we can see it might not be safe for the patient. So we walk in, bed itself is not locked. That's a problem. Bed can move, patient can fall out. There's only one bed rail that's up. Bed rails on the other side are not up. Patient could roll and fall out of the bed. There's a fall hazard there. Also, the patient's intubated, mechanically ventilated. Unless it's contraindicated, the head of the bed is not at 30 degrees, 30 to 45 degrees, which is also a part of your VAP bundles. Would also note that suction catheter is, the way that it's set up here is locked. However, we teach our students to make sure that it is in its collar in the locked position, because if the patient were to be rolled or what have you inadvertently, that could be clicked over into the unlocked position, which if that were to be depressed, then that could cause an issue with pulling out some of the volume from the ventilator as it's being delivered. Also would like to point out with endotracheal tube attachment from the HME. So the last little bit we've been talking about alveolar dead space, anatomical dead space, the combination of those being physiologic dead space, and also introduced to you mechanical dead space. I told you that anything placed between the Y of the ventilator circuit and the patient is going to add to your dead space. So while this little piece of corrugated tubing is beneficial for the purposes of attaching your HME and or your ventilator circuit to the endotracheal tube, the inner portion of that elbow on the suction catheter will attach in to that adapter on the HME. So if you were having an issue with an increase in PaCO2 and you've maxed out what you can do with your ventilator, you need to cut down on your added or extra mechanical dead space, you could remove that piece of that piece of corrugated tubing and take it out and just connect everything so that you're moving that added volume. Additionally, we want to make sure that the ventilator is plugged into an outlet that's on a backup generator. In this situation, it is. So if we were to find that was plugged in somewhere else, we want to make sure that we change that. And also we want to make sure that at a very minimum, we've got a bag and a bag valve mask or manual ventilation device with a mask attached to it. While we have one in the room, it is probably not advantageous that is attached to the airflow meter. In the event of cardiopulmonary resuscitation or a code blue situation and we need to manually ventilate, it's possible someone just grabs that and begins manually ventilating with room air. We would like to ventilate with as close to 100% as we can. So that's something that we want to make sure that we pay attention to. And while there may be other items wrong in the scenario too, also want to point out, if you look at your ventilator, again, aside from it being in standby and attached to a patient, no filters on the inspiratory or the expiratory limb of this circuit. We should be filtering the gases that are going to the patient and from the patient back to the machine. Thank you for your time and attention.